Dr. Byakika, are you talking? We see you unmute, but we can't hear. I want to confirm if your microphone is okay.
You can hear me?
Yes, I can hear you now, Doctor. That's good now. Dr. Pauline, I think you're done using Pauline's iPhone. You could unmute on that device. I will be able to hear you. You can now unmute.
Good evening, everyone. Yeah, good evening, everyone. Sorry, I couldn't unmute. I think the host has muted everyone. And So good evening. And I want to thank you very much for inviting me to moderate this session for Busoka Health Forum. I want to thank everybody for keeping time and sparing time to attend this very, very important session. I know that this session is part of a series of sessions to celebrate the International Women's Day. To celebrate the International Women's Day. Yes, this is part of a series of activities to celebrate the International Women's Day. We celebrate International Women's Day every year on the 8th of March. This day is dedicated to recognizing the achievements of women and girls around the globe. This year's theme is Accelerate Action for Gender Equality. And this theme reminds us that there is still a lot of work to do to achieve equality between men and women. Today, we celebrate the women who have paved way for us as women and who have broken barriers and challenged stereotypes. Our speaker this evening is one of such women. We honor the women who are working tirelessly to make a difference in our communities. We also honor the women who are working tirelessly to advocate for women's rights and to empower other women to do the same. At the same time, we recognize that there is still much more work to be done, because we see that women and girls still face lots of violence, lots of discrimination and inequality in many areas of life, including at places of work. Women are underrepresented in leadership positions, in businesses, and so on and so forth. They also continue to bear the brunt of poverty and inequality. At the same time, women suffer the greatest burden of infectious diseases because of these inequalities. Today, we listen to one of our eminent women in society, who is a person who has been the voice of women and girls. What can we do together? We can all work together to continue speaking and advocating for the woman and to continue communicating the same message to address these inequalities that hold us women back and hold the girl child back. I must say that we have the power to change, and we have the power to accelerate action for gender equality. So I request you to join me to welcome our speaker tonight. Our speaker tonight is none other than Professor Maggie Kigozi. Professor Maggie Kigozi is a medical doctor who trained from Makerere University in 1976 and acquired the MBCHB. She worked in several hospitals in Uganda, in Kenya, and in Zambia. She joined the private sector in 1994 as a shareholder, Director Marketing and Public Relations in Crown Bottlers Limited, that's Pepsi. At the same time, she was elected a board member of Uganda Manufacturers Association. Since then, Pepsi has grown from 5 million cases annually to 100 million plus today. They have also taken over Pepsi in Kenya. In 1999, Professor Maggie Kigozi was appointed Executive Director of Uganda Investment Authority, and she promoted and facilitated investment until she retired in 2011. During this period, Uganda attracted $10 billion of domestic investment, $10 billion of domestic investment, and $4 billion of foreign investment. Many jobs were created. Professor Maggie Kigozi is a feminist. She chaired Akina Mama wa Africa for 7 years, and she has done a lot to empower women. She also plants trees and runs the Zuri Model Farm Limited, growing coffee, bananas, mangoes, and her new initiative is planting oil palm in Sese Islands. Her newest venture is Zuri Apartments. Professor Maggie Kigozi sits on a few boards, including Director Crown Beverages Limited. She's the Chairperson of Makerere University Endowment Fund. She's the Chancellor of Pentecostal University, Ambassador Africa Scout Foundation, Chairperson of ICON, PSFU Advisory Board member, and a Fellow of the Ugandan National Academy of Sciences. She was appointed Associate Professor by Makerere University. She's a keen sportswoman who represented Uganda in tennis, squash, table tennis, and motorcycle racing. She's also a mother of 3. Join me to welcome Professor Maggie Kigozi as our speaker tonight. You're welcome, Professor Maggie Kigozi.
Thank you, Dr. Byakika. I am really happy to be here with the Busoga Health Forum. First of all, to hear about it. Thank you for the good work you do. I know Busoga does trail in some areas of health, and maybe feminism. There are areas where we feel we are lagging behind in that area. So I'm happy that you're having this, and especially today to talk about in the context of the Women's Day. Thank you very much for inviting me. And I was asked to talk about innovation and entrepreneurship in health. And we can focus on women, but health is health. So I thought just to say what innovation is. Innovation is the practical implementation of ideas that result in the introduction of new goods and services. So innovation, that's what the young people are doing, and making a difference in the lives of everyone. But secondly, you need entrepreneurship. That's the ability to develop, organize, and run a business enterprise in order to make a profit. In this day and age, I would add on technology. Technology has come to make our lives easier, faster, and enable us to do so much more. As women in the backbone, the nurse was a female. in the past. I know we have a lot of male nurses nowadays, but I remember a time when we just thought nurses were women. And I guess they still are to a large extent. It is a nurturing job, it's a hardworking job, and therefore, I guess best suited to women, but we need the men there. We need their strength at times, physical strength. I was, as you have heard, I was lucky to be a medical doctor. During my time as a doctor, and I worked for 17 years as a doctor, I wasn't really an entrepreneur or an innovator myself in the medical profession. So I've since been able to do that in the private sector and not where I'm not actually practicing medicine. But during my time as a doctor, I did run a few clinics as a student, BAT clinic and some others, medical school, Mulago. We really believed in learning. So at that time, entrepreneurship was not an issue. We wanted to be where our professors were so that we would continually learn. We faced some political turbulence at that time, which is why I worked in Uganda only for 1 year during internship and then had to leave, but was able with that wonderful Makerere medical school degree to be employed in Zambia, in government and Dollar Hospital. And in Nairobi, after that, when we came back to Nairobi, it was very easy to actually get employed, but I did continue to work in government. Historically, our time, many years ago, government was the main provider of health. It was government hospitals, maybe a few religious, we had our Rubagas and our Namirembe hospitals, the religious, the Muslim, around the Muslim mosques, we have a number of clinics. So religion also took on providing health to their well, they were not selective, they were actually catering for all patients. But private came in a lot later. We had a few people who had their own clinics. Professor Sali, I remember a few of the Asian doctors before they left, but there were not many. So health as an investment opportunity. When I was at the Uganda Investment Authority, we identified it as a priority sector for Uganda. We identified it that we had all that it takes. We had the graduates in the sector. The need was there. Patients were willing to pay. Patients were capable of paying. So it was a very good investment opportunity. We put that in place as part of what we called the big push strategy, where we looked at some sectors in Uganda that we thought would do very well. And health was among these as a service sector. And where were the opportunities? The opportunities were in clinics. I think that was the first one that some of the doctors could afford. And at the time, they were working in government hospital, some other. Then came the big hospitals, I'm sorry, I don't know so much about ginger. I know this is the Busoga Forum. I should have done some research about ginger, but very largely Kampala based. So you'll excuse me, but I'm sure the picture is the same. So we got some clinics and we got the big hospitals, our fellow doctors, Dr. Kanyerezi, Kampala Hospital, Dr. Clark, and with his Nakasero Hospital, Dr. Mbonye, and they would form together, they would invest in these very, very big projects. I actually went to Nakasero Hospital for my wellness check recently, and very happy to see a huge expansion, modernization. It looks good. So we are continuing, the fight continues to provide good health services by the private sector to people who can't pay or who have insurance. So setting up other opportunities in this in your area in the health sector. They are things like pharmacies. Pharmacies are the ones that really please me because they look so beautiful. I remember the old pharmacy. Who doesn't remember the old pharmacy where you would have someone sitting around a table with a few tins of drugs? Now pharmacies are beautiful. They're everywhere. The whole of Kampala, sure, the whole of Jinja, they're all there. So that's an area that, you know, for investment, for private investment, and for entrepreneurship skills to help you run it. X-ray units are available. You can get an X-ray done. Then you have things like wellness, fitness, beauty and health, gyms. All that is part of keeping us healthy. And it is a business. And it is being run by some professional, some health professional. The other area that is then needed was entrepreneurship skills as our topic of today. How are we going to achieve that? Ugandans were very entrepreneurial, but we didn't have the skills. What we did as the Uganda Investment Authority was to attract Enterprise Uganda. I had to really go out of my way, visit so many people to bring Enterprise Uganda here to begin training business people in proper entrepreneurship skills. And so Enterprise Uganda came, but of course we needed much more. We were able to get a project from Iceland, where we also included the Ministry of Health, MOVES, UIA, various consultants, and trained very many entrepreneurs in this, but also became the core for all the development of entrepreneurship that is happening in this country, where people are being taught how to run businesses. Business is not something you wake up and you already know. It is something that you can be taught and you can get better. I can speak to that as a medical doctor. When my husband passed, he wasn't the one in business. I wasn't. I had to go into business. But because I had been part of this drive for entrepreneurship, I knew that I needed the skills. So when Professor Balunywa was in Kamas in Makerere, I was able to go there and attend all those short courses. Didn't have time to do a master's or a whole degree in business, but those short ones, 10 days of entrepreneurship skills, 5 days of public relations, of communication, of marketing, I did them all. And definitely I was a big beneficiary. And all of you, those of you who are in business, and by business today, we are talking health. Business in health. Have you got the business skills? This entrepreneurship that we talk about. If you haven't got it, Enterprise Uganda is there, MOVES Entrepreneurship Center. There are so many training institutions in Jinja, I'm sure as well, that you can go to and make sure that you are running your business professionally as you should. So the other one then is that has made such a huge difference more recently, and actually for us women is fantastic, is the technology. The arrival of the mobile phone changed our lives. Now with internet, what can't you do? What can't you do? Where can't you work from? I remember in COVID, Airtel recognized people, innovators, young innovators who are able to address issues during COVID because we couldn't move. We were stuck at home. So people who were able to get goods to people and the health sector, people were getting sick at home, but they had no drugs. So people were actually getting drugs either online, they were talking online, and then being able to cycle and take the drugs, things like that, and make sure that our patients were continuing to be alive. So they were being recognized for the innovation that they came up with to be able to get to the patients when we couldn't move. We were not allowed to travel around. One difficult one was, our patients with HIV who were getting regular antiretrovirals. There's so much stigma attached to that. So you don't want somebody coming to either bring you your antiretrovirals in a home where people actually don't know that you even have the disease, or a school or something. So that was a big problem, How do we address that? And they did it through technology. Yeah, people were able to get you your drugs quietly and without causing too much commotion about the fact that you maybe already have the disease, and people could be, they can be nasty sometimes, even TB, diseases like that. So technology then came in as the third front to make everything so much easier. And it continues to date. It came in at COVID time, but doctors have continued to work. They are working online. They are, doing research. They are training. We are here now. We are online, So that has been a big, big solution to the problems that we face. So as women, we have benefited immensely. A number of the hospitals that we talk about, the big ones, belong to us. A number of the pharmacies, many of them belong to us. And all these other areas of health that I talked about earlier, a lot of them are run by either our medical doctors or our nurses, our nursing sisters. Okay, I look bigger here. Yes, so now we have the entrepreneurship skills that we now have, and also the technology to enable us to innovate, to find solutions where there are still problems. I think let me stop there. If you have any questions for me, I will be happy to answer. Thank you, Pauline.
Thank you, Professor Maggie Kigozi.
You're welcome.
Professor Pauline, are you able to speak? We can't hear you.
See?
Okay, I could support him as the professor comes back. If you have a question, we could raise up your hand. I could take up your hand and then you could make it out. Or you could also post some of the questions in the chat.
Sorry, my network went off. I hope you can hear me. Sorry about that. Dr. Mkembo, can you hear me?
We can hear you now.
All right. I want to thank Professor Maggie Kigozi for an interesting talk. And I want to particularly sort business and attending some lessons. I want to open up the discussion now. If you have questions, please post them in the chat. If you'd like to speak out, please put up your hand so we can hear your voice and question. All right. I don't see any hands yet. If you have a question and you'd like to speak out, please put up your question. In the chat, we have a question from Happy. She says, what are some of the entrepreneurship courses that you recommend are good for someone purely medical?
Okay, I think let me try to answer that first. If you're purely medical, but you're not an
venturing into
entrepreneur.
business.
Oh, you
Professor
are
Maggie, did you hear that?
Yeah, you can repeat it now.
That you recommend are good for someone purely medical, but venturing into business.
Right. Yes, definitely.
I can read.
The number
can
one
I read
would be
2 so that you take 2 at a time?
All right.
The second one is from Oloya Patrick, and he says, Prof, I have been having idea of starting mobile geriatric clinic, but then I lack entrepreneur skills to put everything together and start. What is your advice for me? The two are very related. Please go ahead, Prof.
Okay. Yes. So for venturing into business, what courses do you need? Really, you should do entrepreneurship skills training. That is the overall to give you the ability to, have a vision, be able to work on your plan for it, look at the financing and how you're going to manage it, and look at the whole comprehensive enterprise. And you can do this in many places now. Enterprise Uganda is one, MOOBS is another one, Entrepreneurship Center, but there are also many other places where you can get that. That one's critical. You are going into health, so we are presuming you already have the health background, and that is not something you need to learn. But if you do not, there you need to hire the right person, because the skills are important. Those ones are not to be bought or whatever. They have to be there. The regulators will want to ensure that your business is being run by somebody who is a medical professional. And then what else would you need to do? There's the marketing. People know where you are, what you're doing, how do you get to do that? And now with social media, it is a lot cheaper than it used to be in the past to let people know where you are. Your financial management, that's another one that's often complicated. It's part of the entrepreneurship skills training, but if you haven't really got it, then you need to do a special course on it. I needed that. Finance was my main challenge on how to manage it. So those are some of the courses. And then, of course, on the medical side, depending on what you are specializing in, you need to stay on top of that as well, so that your patients will be happy. The one who wants to start a mobile geriatric, I think that would be very helpful, being one of the ones in the geriatric group. It will be very helpful, and it is mobile, so you're able to move from place to place and get to the patients who may not be able to travel as well. I think it would be a brilliant idea. The elderly, would they be able to pay? I think that is another problem. Some of them can, of course, some of them can pay. Others may need to get some support somewhere. And also the diseases of the elderly are actually quite severe sometimes, and sometimes very, very difficult. We do tend to get sick and seriously sick more than others. So yeah, that would be the difficulty you would face. But I think it's a brilliant idea, something nobody has really, at least I don't know anyone who has come up with it. So do go ahead and work on it. See whether it makes business sense. You must remember you are there to make money. So it should make business sense. Yeah.
All right. Thank you, Prof. The next question, I will read maybe 2 or 3.
Okay.
Nakato says, how can you balance between family and business? And Julian is asking, at university, she did a dissertation on maternal and child health in Uganda. And as a public administrator, how does she tackle this issue now that she's out of university? The third question from Petronella Charity, what avenues are available to support medical innovation endeavors for young entrepreneurs in Uganda? Those are 3. Maybe you could take those and we'll take another 3.
Okay. Yes, Nakato, family and business. You shouldn't have to choose between the two. You need them both. The family needs the business to survive, and the family is very important. So, for me, it has always been clear the family comes first. So you should not have to choose between the two. You need them both, and but family, especially the children and the husbands, if you can have a family that's moving well, that you understand one another, you support one another, the children should be okay. You can make sure they're okay. Luckily in Uganda, we are able to get some house help. I'm now in a place where it's quite difficult. So the stress on the family and looking after the children is really huge. So you are able to get some help in the home so that your time is freed up. But children must never be ignored. They're still number one. And your business comes second. But if you know your business well and you can manage it well, you are able to do both. You are able to do both, yeah. Maternal and child health in Uganda, where else can you use it? I think there are a lot of consultancies in these areas that you could be working on. I don't know whether it was you're a medical professional, the one who did maternal and child health, or you just did that as an item alone, a standalone. How you use it? Yeah, there are a lot of NGOs and donors. Donors are having problems nowadays, but otherwise donors were doing a lot of research, as are our various universities. So I think this would be very useful for people working in the area and doing research in that area. Support medical. What was the last one? Didn't finish writing it. Endeavors.
Somebody was asking about how do they use the information they gained from university, where they did a dissertation on maternal and child health.
Yes.
And they're now into public administration.
Okay. I tried to answer that one. What about the next one?
The next one is about, let me read 2 or 3 more. What avenues are available to support medical innovation endeavors for young entrepreneurs in Uganda? This is related to 2 or 3 others that are asking about capital to start a business, as a medical center, as a pharmacy. Yes, maybe you could take those 2.
Okay. Yes, support to medical endeavors would be capital. Yeah, you need capital. So really, basically, the most of us save. We try to save so that we have some money that we can use to start our project. Then when you do have some money, you can then be able, I know as young people, you haven't had the opportunity to raise money yet, to save money. You haven't maybe been working for long, so you don't have the savings. family business. I don't know if your families are able to come in and work with you. Those who have families that are able to do that would be lucky. Then the other one, there are a number of projects. Like for the women nowadays, we have a new project called Grow, where capital is provided, but you have to have been in business. You have to have started. It would not be given to new startups, though there is some training for them. And so it is banks, borrowing, which is tricky. Partnerships. Ugandans don't like partnerships. And I know hospitals like Nakasero Hospital, a number of our lecturers got together and they were able to put up these projects together. So some of them were working in other countries and they came in and put these projects up together. Us in Pepsi, there are 3 of us. You cannot do it alone. So sometimes partnering with your friends might enable you to do something to be able to invest in something and do it together with your different skills. I guess otherwise there are various projects nowadays of trying to help the young people, the banks, Stanbic and others, Standard Chartered, even ABSA, and a number of even now DFCUs and those ones, they are trying to train young people and also enable you to start your business. But how you get to them, I really don't know. Capital is a problem. Capital is definitely a problem, but you start small and you grow. Start small, accept you start small. You won't start with a big business and grow your business by being very, very good at what you do. Yeah, that would be my only advice.
All right, thank you, Prof. There are a few more questions. Some questions were related to how to get capital, others about group practice, and I think you have already addressed those. There's one more question here that says, it so happens that medical businesses in Uganda take a great struggle to thrive with a lot of resources needed to invest. You have mainly been into non-medical business, which you probably started after some years of medical practice. How do you advise someone who wants to start earlier on non-medical businesses? Also, doesn't non-medical business venturing derail you much from the focus on the medical career? Maybe you could take that one.
Okay. Yes. Non-medical business, yes, definitely derails you. But for me, it was my father who wanted me to be a doctor. It was never a lot short of my desire to be a doctor. But my father told me while I was in nursery school, I should be a doctor. So I became one. But on the way, when my husband passed, I had kids, I had a family. Doctors, sorry to say, you do not earn much. And I needed to do better. So that's when I shifted to the private sector where my husband was. I took over from him. So it was not, but I had worked for 17 years. I don't think I really didn't do my part. I worked for 17 years as a doctor. My last place of work was Parliament. I was running the parliamentary clinic from 86 there to, some 5 years, where I treated the MPs and people like that. So moving into non-medical business is, yes, it look like a waste of skills. Looked like a waste of skills. But as you see, I then went into Uganda Investment Authority, where health is a priority sector. So to enable me to promote the health sector, the fact that I knew it, I knew what it was about, did help in what we were able to achieve. And we achieved a lot. You see the number of hospitals around. that are private, whereas at that time there were very few private, very little that was private. So my medical degree did help on the bigger picture, on the policy side. But not everybody will be able to get into a position like that. So if you have a medical degree, hopefully you can use it for medicine and not get derailed. On the other hand, your family needs money. So if you fail to make money on the medical side, you can still use your skills differently in other places. Yeah. So I wouldn't say you should be fixed in the medical, on the medical side, not be forced to do medical business if you're finding it is not working for you. Yeah, and you can do some other thing.
Thank you, Prof. A related question is, how can you balance the public office and private business?
Yes. Public office and private, yeah. So you want to be holding both. Yes, a lot of people do. You have you work in Mulago, whatever, and then you have your private clinic. So how you balance them is make sure you do your work that the government is paying you, government or whoever it is you work for is paying you for, and you manage in your own time, the other work that you want to do in your private clinic. So that it's balancing that and trying to be fair to your employer, so that you are delivering on that side as well, and not diverting the patients to your clinic that would have been going to the general clinic that you work for, the general hospital that you work for. So really it's ethics and trying to deliver a service as best you can, while at the same time running your business. What the doctors used to do I remember when I was an intern, and also as a student who will qualify soon, we used to work in the clinic while they were busy during the free time that we had. I would be working, or during my holidays, I would be working. And then he or she can be in the main hospital and come in later on to see the patients that really want to see them and don't want to see the young students who is there. Yeah.
All right, thank you so much, Prof. So I will ask those with their hands up to unmute and speak. We have 3 hands up from Kasibante Samuel, Paul Chibenge, and Winnie Nabukera. In that order, please unmute and ask your question, and we'll summarize after those 3 questions.
Yes, thank you so much, Professor Byakika. Yes, can you hear me? I want to be sure that you're hearing me.
Yes, can hear you.
Great. Thank you so much, Dr. Maggie, and thank you so much, Dr. Byakika, for the wonderful moderation of this session, and for the good work, Dr. Maggie Kigozi and Dr. Pauline, you're doing for this country. Thank you so very much. Now, there is a detail that I think we need to put into consideration, a man called taxes. I work for government, but also run private lab in Ginger City. But I wonder, with all the innovation that there is around us, it's quite difficult to break even. The technologies can be quite very expensive, and I think clients have been claimed to free services. So breaking even can be difficult. I was actually recently surprised when council came and then they were asking us for a tax, I think, on a signpost, and this actually loops into the question of business mortality, because I think Dr. Mukem was part of this forum, but he's always telling us a list of clinics either that require to be sold out or something, or closing or something like that. Loops into the issue of business mortality in Uganda. I think you address us on that issue of taxes, issue of of mortality because you are the helm of investment authority. So you must have been beneficial to researchers on investments in Uganda and their longevity or their lifespan. And then talked about that. Somebody asked about incentives in the investment authority frameworks that support businesses in Uganda. Please, I think you need to throw more light with some degree of details because many people actually risk their capital. I remember meeting somebody had done a bachelor's of agriculture, got some money, put it in medical business. The whole thing collapsed like a stack of papers. He was selling his equipment cheaply.
Presidente, please keep your question brief. We are running out of time so that other people can also have an opportunity to ask.
Thank you. I've just I had a plethora of issues. Thank you.
Okay. Thank you, Paul. The issue of taxes, the issue of mortality. Somebody's music. Yes, and failing businesses. I think your topic today really covered what would help you. The entrepreneurship skills. As you're going into a business, do you know how to run a business? Or you're just bringing your nice medical degree and trying to run a private lab? It has to be run like a business. It therefore pays taxes, and you should know or should not or does not pay taxes, depending on what the law is saying. So it is running a business is not that simple. So you need to actually take the time and go and get those skills in entrepreneurship. And then also work out how you are going to survive. The business is going to survive and not collapse. Incentives are there for some businesses. I would have to recheck what was there for, I left UIA in 2012, so it's a long time ago. And I am actually no longer in the health sector. But they are incentives for you, and you need to look them up. You are about. So yes, business is not easy, not only in your sector, but in all other sectors. And you need to make sure you are strong enough, you know enough of the entrepreneurship skills training to be able to run your business. And you start small and grow. And do you get a salary? Maybe not for a while. You don't, the income is not enough. You need to retain it in the business. And you need to be, hopefully, if you have your other job, that would be very helpful to keep you going. Yeah.
Thank you.
Otherwise, we do fall sick. I think the patients are always there. But the other issue is, do they have the money? And you're right, we are not cheap. Health is not cheap. Here where I am, the hospitals are incredibly expensive, and they have to be because of they are able to deliver the kind of service that people want to pay for. So they are very, very expensive, which means our customers generally in the country would not be able to afford it. Yeah. So yes, it's a problem. You need to balance and look at yourself as a business. Yeah.
Thank you, Professor Kigozi. We have 2 more questions. I would like to request Winnie and Paul to keep them very brief. I'll give each of you 30 seconds to ask, and then we'll listen to the answer from Prof. Winnie, over to you.
Amazing. Thank you very much, Prof. Maggie and Prof. Pauline, for the engaging discussion that we are having right now. My name is Winnie here right now, social entrepreneur and the CEO Little Win Foundation. We offer soft skills, entrepreneurship, and work readiness programs. So, Prof, for me, it is really to appreciate you. And for me, I'm very passionate about entrepreneurship. When look at the very high numbers of unemployment among doctors, nurses, midwives, and the different healthcare providers, for me, I feel that actually entrepreneurship is the answer to the very many challenges and problems that we have in our communities. And I feel that this should actually be a reflection to all of us to ask ourselves that besides what I'm doing, what else am I doing for community to make sure that I'm building a better and a healthier community? I'm adding value to myself and also the people that are around me. Every day we have a lot of young people asking for jobs, but I usually say, oh, sorry. We usually say that actually jobs are not there, but they are rather created. So what can we be able to do to encourage young people to embrace entrepreneurship early? Just as you stated it, that you don't have to start big. I've always seen people that say, I don't have a lot of capital, so I cannot do business, I cannot start up at any venture and all of that. But it is about knowing what you want to do, identifying the problem and starting. Good, but money is going to come if you are able to understand what you're doing. Above all the problem, money can be able to come back. So for me, it is a reflection of us. Thank you,
Winnie, for those comments. Thank you, Winnie, for those comments. Let's listen to Paul. Thank you so much, Winnie, for the extra comment.
Good evening, Doctor, and everyone listening. Yeah, Professor Maggie Kigozi, I was touched by the fact that after you finish your internship, you spoke about working in Zambia, and then right back, you didn't come to Uganda, you worked in Kenya. Yes, my question is, looking at what was happening by then, what attracted you to go and work outside and leave the people that you grew up with to serve in Uganda and go and work outside? Looking at what happened by then and what is happening now, we have interns that are spending years without being posted for internship, and the rate of unemployment of the doctors you're talking about is really very high. I mean, I heard a circle of medical doctors, but people are struggling, even if you give them loans to pay them back. How do you see, I mean, where do we go in this profession as a country? What do you see the future in the medical profession?
Thank you, Paul, for that question. I think we had one more question from Ernest Okot.
Hello. So my name is Ernest. Thank you very much for the talk. So my question is about innovation in health. Often it's very hard to get access to facilities or to medical equipment as an innovator, let's say in IT. I just want to ask if anyone knows of any kind of sandbox that can allow healthcare innovators to access like markets and basically build in a sandbox environment.
Okay.
All right, thank you, Ernest. Over to you, Prof.
Yes, Winnie, yes, we have been talking about entrepreneurship skills all the time, those soft skills. Very, very important that the medical people also have that so that they can run businesses efficiently. Paul, working outside was not by a choice. We had insecurities in this country. My husband used to produce beer, and during Amin's time, they said the beer he had produced for the army had a different colored top, so that beer was bad. So they were trying to grab him. And you can imagine at that time what would have happened to him. So he had to leave. I followed a little bit later after I'd finished my internship. And then we stayed outside. We could not really come back until the President Museveni came here in 1986. It was not safe for us in the country. So it wasn't a choice at all. Nobody wants to leave Uganda. Uganda is beautiful. Where else do you want to be? We don't want to be out there. But yeah, so it wasn't by choice, and we would rather work here. But you've added on the fact that it's very difficult, there's no employment. I think what happened again is a confusion with the private sector coming in and graduating so many medical students, that government was really not ready to take up. And so that is the problem. There are so many students coming in from Mbarara, is it Mbarara University? Basaja, what's his name? Yeah, that other university in Mbarara. So that causes the huge numbers that are unmanageable. And it's unfortunate. I hope solutions are being found. We were able to go to other countries and work, but now those countries at that time, Makerere was one of the few medical schools in Africa. So for us, we got jobs just like that all the time, wherever we went. Kenya, I just walked up to the ministry and I came down with a job. Same in Zambia, no problem. But now that's not the case. They have universities as well. They have their medical students as well. So it's not so easy. Ernest, about innovation in health. Yeah. You are the innovators. We want you to innovate. Yes, you need support. I know we have the Innovation Village who would be willing to listen and see if they can support you in your innovation. They are MasterCard Foundation, works in a number of places. We have this Grow project, which is for women, which may be able to take up some of these. The various banks are doing a lot of training, and we have our various circles. We have our various institutions like vocational colleges and such who can add value to you. But yeah, the medical fraternity is an elite kind of thing, so not everybody can help us. We need to be able to help ourselves, so we need to work on it ourselves. We are the ones who understand our sector. But yes, you can get some help from these people as far as, say, technology or training is concerned, or finance from the various financial institutions. That's it. We've lost Pauline again.
Okay, I think she's getting back. Okay, I want to take this opportunity to invite Professor Peter Waiswa to give closing remarks.
Good evening, members. I hope you can hear me.
Yes, Prof.
Yes.
Benjamin, can you confirm?
You can hear you, Prof.
We can hear you.
Professor Kigozi, one time we sat together at the School of Public Health Party, end of year party. I'm Peter Waiswa and I work at Makerere. I enjoyed the discussion with you and your humility. Thank you for being big yet accessible. I am the chairperson of Busoga Health Forum. We started Busoga Health Forum because we thought Busoga had many people in the health sector, but we could use this platform to organize ourselves to give something back to society. So we don't just do these webinars, but actually we organize as an NGO, which works directly with the Chabazinga, but also with the communities of Busoga, delivering real services. Recently, we just actually convinced Ginger City to give Busoga University land for a medical institute. And they gave it, and also Heart Institute gave land to, Ginger Hospital gave land to the Heart Institute. So we do advocacy, we do service delivery, but also we provide this platform, which started during COVID. During COVID, we had the first talk by Professor Dr. Nakwagala on COVID, and since then, we've never stopped. Last year, we reached over 10,000 listeners in CM1E. So for me, I'm thankful to you that you accepted to come and speak to people on a very important topic, which is entrepreneurship. Because like you said, health workers, we badly need it. There are many opportunities, but if they are entrepreneurs, but most health workers are not good at this. There are already many opportunities actually to work abroad, but many of them don't know how to market themselves. So these are some of the skills, and I would like to invite you back to Solar's Forum. Thank you for coming, and happy Women's
Before
Day.
you close, Professor
Yes,
Waiswa, sorry, my network went
yes,
off
yes,
briefly.
yes, Professor
Thank
Byakika.
you.
Yes.
Yes, thank you, Professor Waiswa. I'd like to take the opportunity to thank Professor Maggie Kigozi for the presentation this evening and for continuing to empower the girl child. Thank you so much, Professor Maggie Kigozi. Your presentation has been very, very insightful. Just a few highlights. You have highlighted the fact that everybody who would like to go into business needs to seek these business skills to be able to run their business as well. You have also highlighted the need to balance family and business and work. You also advise the health workers to run businesses, but not to neglect their primary role if they're working in the hospitals and not to divert these patients. We thank you very much. You also gave some thoughts on how people can acquire capital to run their businesses. We want to thank you very much for that. I want to thank Professor Peter Weiss for coming in with the closing remarks. Professor Peter Waiswa is actually the founder of Busoga Health Forum, and he has steered this forum very, very well. Professor Peter Waiswa, thank you very much. Professor Maggie, we had close to 200 people. There were actually 196. I think that was the highest number. So we thank you so much for the work that you have done this evening, and we hope that people will go out there and start thinking seriously about these businesses. I also want to say that there's what they call passive income. So those who are busy and who are aspiring to fulfill their medical careers, please think through also the passive income. It also actually works very well. And finally, you made a comment about the influx of medical doctors from a certain university. Certainly, it is not Mbarara University. Mbarara University of Science and Technology is the second public university in Uganda. And our numbers are about 80 to 90 per year, produced per year. Very high quality doctors. Thank you very much. I just wanted to end on that note. Thank you so much for the evening. And I thank everybody who has attended this session. And I hope that we shall go out there and attempt to start the businesses as has been written in the charts. Thank you so much. Over to you, Professor Waiswa.
Thank you so much, Professor Pauline. So, Professor Kigozi, we are very proud of that, and we'd like to invite you back to Solar's Forum. Benjamin, if you can bring a certificate of appreciation that we'll give to Professor Kigozi. Professor, will receive this, it will be sent to you, and is an invitation back to speak the country, because this is national. And next, Professor Pauline Byakika, my very good friend, very proud of you. And thank you for defending Mbarara University, because I actually trained there, and I'm very proud alumni. Thank you for coming over. I told Benjamin, why don't you invite Professor Pauline to chair this? Because the professors need to meet. And the women are that, very great women. Happy Women's Day, Pauline. Proud of what you are doing. And in Makerere, we miss you. But I'm happy that you are in the mast. And receive that certificate of appreciation. And we hope you also come maybe as soon as possible to make your own presentation. Happy Women's Day. And Professor Kigozi, if you can give your closing remarks and even promise to come back.
Okay, thank you. Thank you very much. Wow, that was a big group that we have in the room today. So I'm happy to have been heard by so many. I apologize, I am not in the medical profession right now, So I am not very up to date about exactly what's happening there, but I could talk about what happened more in the past. So yes, thank you very much for the invitation. And I was happy to come back and meet my fellow doctors and medical professionals.
Thank you, members. Everybody, have a good night. This presentation will be available on YouTube. And I would like to thank especially Benjamin, because Benjamin, who coordinates this, is actually a certificate nurse. But how people can be empowered even to manage doctors or from all over the country and the world. And I want to challenge every nurse, feel that you can do more. Happy Wednesday to everybody. See you next Friday, 8 p.m. God bless. Bye-bye.